So the Metro Manila Developmental Screening Test, or the MMDSE, is a specialized clinical useful tool designed for developmental delays of children ranging from birth to 6.5 years old. So this is not a diagnostic test or an IQ test, but rather a standardized method for objectively evaluating the child's progress in comparison to their peers. So by utilizing a specific test and a set of standardized materials, the MMDSE helps health professionals to identify children whose development deviates significantly from the norms, ensuring that those children who needs further evaluation are caught early on.
The primary purpose of the MMDST is early detection and intervention because many developmental disabilities are not physically obvious during a routine checkup. This screening provides a structured way to observe a child's functional abilities. By identifying delays early, before a child enters the formal school system, healthcare providers and parents can implement corrective measures, therapy, or specialized stimulation programs. This proactive approach significantly improves the long-term prognosis for children who may have underlying neurological or developmental challenges.
Hi! The MMDST is a Philippine adaptation of the Denver Developmental Screening Test, which was originally founded by Frankenberg and Dodds. Recognizing that the Western developmental norms might not perfectly align with the Filipino cultural and social context, that's why Dr. Fabi Williams conducted a study standardized the tool for Filipino children. This modification involved into the age-specific task to reflect the typical growth milestones of the Filipino children for more accurate and cultural sensitive to the local pediatric nursing and community health practice.
The test is divided into 4 functional areas. First, the personal social sector measured a child's ability to interact with others and perform self-care, like feeding or dressing. Second, the fine motor adaptive sector evaluate hand-eye coordination and the ability to manipulate small objects such as stacking blocks or drawing shape. Third is the language sector, which focuses on the child's ability to hear, follow direction, and use verbal communication. Lastly, the gross motor sector assess large muscle movement. These include the child's ability to sit, walk, jump, and maintain their balance.
The MMDST kit. To ensure the test is objective, we use the MMDST kit. It contains the MMDST manual and test forms for documentation. For the child, we use a bright red yarn pom-pom for visual tracking, a rattle with a narrow handle for auditory response, and 8 1-inch wooden blocks in red, yellow, and blue-green for stacking tasks. The kit also includes a small bell, a rubber ball, and a glass bottle with a 5/8-inch opening. We use cheese curls to specifically test the pincer grasp, the child's ability to pick up small items with their thumb and forefinger. Finally, a pencil is used for the drawing task. These specific materials are essential for valid results.
Start by introducing yourself to the parent and the child. Explain that this is not an IQ test and the child isn't expected to pass every single item. Building rapport is essential for an accurate result.
So good afternoon po ma'am. My name is Jillian Therese Lina Mananap po and I am from Sultan Kudarat State University Nursing Department. So today po ma'am, may gagawin po tayong developmental test sa inyong anak. So paalala lang po na ang MMDST ay hindi po siya intelligence test, kundi ito ay developmental test po para sa inyong anak. So are you ready na ba?
Yeah.
Okay, let's start.
To calculate for the age for Metro Manila Developmental Screening Test or MMDST, subtract the child's birth date from the test date, the years, months, and days. Borrow 30 days for a month and 12 months for a year if needed. If the child is born younger or born premature, adjust the age by subtracting the weeks of prematurity.
So, hello ate! What's your name?
Hello everyone, my name is Zara Evansta Cerecilla.
Yay! So, how old are you now?
5.
Wow! So, are you excited for today?
Yeah.
Yay!
Next, we find the child's age on the scales at the top and bottom of the form and draw a vertical age line. This line shows us exactly what the child should be able to do at their current developmental stage. Step 4. We start with the personal social sector and move down to gross motor. Administer at least 3 items that are completely to the left of the age line and all items that the age line passes through. If the child fails an item, continue moving to the left until they pass 3 items.
So, ang first natin po na test is para malaman po natin if kaya na bang magsuot ng damit with your supervision po, ma'am. So, baby, pwede mo bang suotin yung damit mo? Okay, so next, pwede mo ba maboton yung mga botones mo, baby? Sige. Wow, very good. 1 down. Last 1. Last 2. Yay! So, ma'am, pwede ko na pong umalis at pwede mo na po kaming iwan. So, okay lang ba na umalis si mama? Bye! Okay. So, next. So, can you see this? Pwede mo ba ni i-draw for ate? So, sige nga. I-draw nga. Wow! Very good! Appear! Yay! Okay, finish na sa square. So, can you hirap? So, fast. And, so next, kabalo ka ba mag-draw sang tao? Can you draw tao? Meron ka mag-draw ng girl or boy? Sige, gani, i-draw mo ng girl or boy. Wow! Wow! Two, 3, 4, 5, 6. Wow! 1, 2, 3, 4, 5, 6. Very good. So pass, draw, span in 3 parts. Draw, span in 6 parts. Very good. Appear. So next, we will be doing fix longer side lines. So, alam mo yung lines? So, mag-draw si Ate ng line. Okay. May 2 lines. So, sa 2 lines, saan ang mas mahaba? Wow! Okay. So, dito, saan ang mas mahaba? What if ito? Saan ang mas mahaba? Here ulit. Saan ang mas mahaba? Wow! Very good! Appear! Fist bump. Okay, next. What we have to do? Next naman. Okay. So, alam mo yung cold, tired, and hungry? Kung nalamigan ka, Ate Z, ano ang ginagawa mo? Ginagaumot ka? Okay. What if nagutom ka? Anong ginagawa mo? Kaon. Kung kapoy ka, ano naman ginagawa mo? Oh, rest. Wow. Okay. So, next, we have to recognize 3 colors. You know your colors? So, meron diri si ate nga, 3 colored blocks. May 3 colored blocks si ate. Kaya, so Are, what color is this?
Red.
Red. Ito?
Yellow.
What is ito?
Green.
So, ulit. Shuffle, 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 shuffle. Ito, what color is this? Ito.
Yellow.
How about this?
Green.
Here?
Yellow. Green. Red.
Wow, okay. Very good. Appear ulit. So, next, may question si ate sa'yo. So, kung ang mama is a girl, ano naman ang papa?
Boy.
Very good! So, next, kung ang coffee, init, ano naman ang ice?
Cold.
Very good! So, next, kung ang elephant, big, ano naman ang mouse?
Small.
More beer. Okay, next we have may mga words na ibigay sa'yo si ate. Dayon, isabihin mo kung ano yun siya, okay? So, first, ano ang ball?
Toy.
Toy. Ang sapa, river, ano na siya?
Water.
Water. What if ang desk, lamesa, ano na siya?
Table.
Table. Ang house. Ang house.
Bahay.
Wow!
Easy, ang next natin gawin is mag-balance ta sa isang paa. So, si ate muna ang magawa ha, then you follow. Okay? Mag-count ta 1 to 10. So, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10! Yay! How about you? Your turn naman. Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Yay! So, yan. Go. 2, 3, 4. Yay! Okay, next. What we have to do pa backwards naman ta. Magbalik naman ta, okay? So, ganito. Follow tita. Here ka. Like that. Sige ha. Follow ate. Follow ate. Here pa backwards naman. 1, 2, 3, 4. Yay! Appear! Congrats! 8.
In step 5, each item is scored as follows. P for pass means the child successfully performs the task. F or fail, the child fails to perform. R or refusal, the child refuses to perform. And NO or no opportunity, the child has not had a chance to perform the task, like riding a bike.
What is a delay? A delay is when a child fills an item that is completely to the left of their age line.
Finally, we will interpret the whole test. Abnormal means 2 or more sectors have 2 or more delays. Questionable is one sector with 2 delays or a delay with no passes on the age line. If the results are abnormal or questionable, we don't panic. We refer or we recommend a follow-up checkup, or we refer a child to a specialist for a diagnostic evaluation.
The MMDST is far more than the checklist of tasks. It is the bridge between the child's current developmental state and specific support they may need to thrive in the future. As health workers and educators, our role is to be observant, patient, and precise.
We are the first line of defense in identifying those subtle gaps that, if left unaddressed, could become significant. Remember, a delay on this test is not a label of failure. It is a signal for help. When we perform MMDST with accuracy and empathy, we provide parents with the most valuable gift, time. And here's a gentle reminder.
Development is not a race to the finish line,
but a journey where every child deserves a fair start.
Every child deserves a quality care to walk their own. Without judgment and disappointment, through MMDST, we choose to see every milestone.
No matter how small, a victory is worth celebrating.
Every child's progress is not a competition. It is a promise of potential. This is BSN 2A Group 4 Animo Sa